Story 1. Essential workers were absolutely at a disadvantage. No hazard pay. No extra paid time off. Just a picture of someone wearing a mask making heart hands at us. Story 2. Grocery prices will never be the same. I miss the days when $50 could buy you good food for a week. Now it's all processed junk with a 60% markup from 2019. Regarding the "well, don't buy junk food then" comments, I have a strict diet to adhere to due to Crohn's disease. I literally cannot eat junk food, which is precisely the problem. I can't simply replace chicken breasts with ramen and hot dogs. Plus, things I bought in 2019 that were staples in my diet now have multiple additives and new chemical ingredients, and all these fillers upset my stomach. Do better. Story 3. The movie Contagion was overly optimistic about how people respond to crisis. The History of Trunks Dragon Ball Z abridged episode, on the other hand, was shockingly on point for how nonchalant people can be about it. Story 4. We learned nothing. Sick people still at work, coughing and sneezing in public without regard. I heard so many people saying the government was doing this to make us compliant. However, everything has gone back to the way it was before, but worse. Story 5. I think that a lot of the collective frustration and rage people feel right now, which manifests in everything from increased road rage and car accidents to the way people vote, is unprocessed trauma from the pandemic, and I have absolutely no idea what to do about that. We were stuck in our homes, 1 million people died just in the United States, and we all had to go back to our jobs and lives. Story 6. I am mostly speaking from an American perspective, but I think some of the same lessons are true worldwide. A lot of people do not react rationally to a crisis. Unfortunately, that includes politicians whose jobs it is to manage crises. High-level plans for managing a pandemic relied far too heavily on the public voluntarily doing the right thing. When the public did not do that, government agencies did not have solid backup plans. Early communication missteps led to distrust of the government that worsened those plans even more. Story 7. Worked as a certified nursing assistant throughout the pandemic. You truly got used to the routine of donning and doffing personal protective equipment for half your rooms because they were COVID positive. Sticking a test swab in your nose every other shift and waiting the 15 minutes in the nurse station together to see who was going home and who was pulling a double to cover. Then it cooled down around the 3rd year and it was testing once a week, masks in a couple of rooms, personal protective equipment maybe once a shift. Then October 2024 hit like a train. A 148-bed facility had 72 residents with COVID in a month. Our nurses and certified nursing assistants went from 56 workers down to 5 nurses and 24 certified nursing assistant staff. Walking into shift and seeing the big yellow signs saying to put on a mask and go to a specific room for COVID testing was truly post-traumatic stress disorder for most of my coworkers. Personally, I had to take my anxiety medication because I wasn't noticing it, but my body was lightly shaking standing in the line, and my coworker pointed it out to me. I had just spaced out thinking about how difficult the first round was. Story 8. I have realized even more how important and undervalued the medical community is. I have realized what gigantic jerks most normal people are and how far they will go to avoid basic kindness for others. And I hope I am prepared now to hunker down during the next one. Story 9. Worked at a hospital through the pandemic. Something I'll never forget. I saw and still see 2 sides of the pandemic. Those for whom it was very real and carry a lot of trauma with them to this day, and those who were home, many of whom believed it was all fake and overblown. I personally never thought I'd see that much death in my life. I don't ever talk about it with friends or family. It's just something I try to forget. Story 10. I worked in healthcare as an essential worker through the whole situation and feel like an idiot because I worked hard while friends and family collected substantial checks and stayed at home. At the time, I thought I was doing something good for my fellow people in country. I know that sounds naive, but I was in my early 20s and not fully jaded yet. Story 11. It was and continues to be a mess. Essential works basically means expendable workers. And the almighty dollar is vastly more important than countless human lives. Story 12. I was drinking daily and eating out for every meal. Then, during the lockdown, I became sober for almost 5 years, started cooking at home, and lost 15 pounds. The lockdown was great. as it broke all my habits and led to a total health reset that wouldn't have happened otherwise. Story 13. That people at large really disappoint and do not care about anyone but themselves. I also work in medical packaging, so I was there every day, 12 hours a day, because our workload skyrocketed, working with people who didn't have any interest in learning anything or engaging in teamwork, so I had to do 5 times the work. No work from home for me. It was miserable. But at least I didn't work with the general public. It became the new norm to mistreat them even more than they did before. And in a lot of places, the attitude still hasn't changed. I was always told going through hard times was supposed to bring you together. What I experienced was completely the opposite. Story 14. I think it really messed up an entire generation of kids in school that they had to stay home, attend classes remotely, and be in lockdown situations. I think there is going to be a lot of leftover mental health and developmental issues from this for kids of a certain age that went through that. Story 15. COVID-19 wreaked havoc and killed more than 1 million people in the United States, and it wasn't even that deadly of a disease. If we get another pandemic with a more deadly disease, even one with a 20 to 30% case fatality rate, we are in serious trouble. Story 16. It was a chaotic situation, and the effects of it will last for an unknown duration. People were deeply affected, and we are all still experiencing anger, which is leading to increased animosity among us. I know I feel it. Story 17. I worked at a major regional hospital in a poor area through the first 18 months of the pandemic. I did death paperwork and registration on night shift. Let me give you some stories. The first suspected COVID-19 case our hospital ever had, she was negative, told me that she couldn't believe she could have the virus. I'm a good person, she said, as though disease is only punishment. The first COVID-19 death I worked on was a relatively healthy 30-something whose first symptom of the disease was a debilitating stroke. We think COVID-19 is just in the lungs, but its real impact is blood clotting. That's why it hurts the lungs so much. But the side effects of blood clots are numerous. We were given flimsy surgical masks that did not seal at all and were told that was enough in the early days. Meanwhile, rooms with patients actually confirmed to have COVID-19 were N95 only. I couldn't be fitted with an N95 until a year into the pandemic because I didn't need one as badly and supplies were limited. Then the government said the disease wasn't airborne, just droplet-borne, so the surgical masks were enough. Still, it was N95 only to get into patient rooms. Then we were given KN95s, which are only a bit better because they shape to the face somewhat. Still, the patient rooms were only N95 to enter. Then, after about a year, word got out that COVID-19 could indeed be airborne, with the implication that the lower contagious chance was enough to tell the public that it wasn't, so they could ration N95s. I got fitted for an N95 then, luckily never had to use it. I still feel betrayed on that one. The problem is, the average American is raised from birth to hate any organization that controls them unless they could potentially buy it someday. So when the government lies, it emotionally convinces us that every other claim by the government is false. I had coworkers who took the mask white lie and ran with Robert F. Kennedy-level anti-vaccine misinformation from there. I've watched long COVID-19 hit loved ones. I've watched drivers go impaired from COVID-19 brain fog and they don't realize it. That's actually how I had my first accident in over 10 years. On the political and economic side, I've watched America try at every opportunity to downplay the disease. It still kills, the vaccine is still imperfect, and our immunocompromised friends are still terrified to go into public. But the oligarchs demand their money and blood greases the cogs, so we all went back to work. We are so addicted to the sense of normalcy that we don't care who dies to give it. Eggs too expensive? Blame the immigrants. Disease killing grandma? Hope you had a good life, I have to go to work. I watched supply chain disruptions be taken by otherwise reasonable people as signs of the end of the world while we hid the actual death and frothy lung foam from them. We sanitized the bodies and put them in opaque bags so nobody had to see death in personal terms. I watched the people of America live in a state of complete denial, only facing reality when their shields cracked and they had to cry until they could put them back up. America didn't go to war in Iraq in 2003, we went to the mall. And America didn't go through the COVID-19 pandemic, we went into denial. I have lifelong mental illnesses and traumas. When everyone else was losing their composure and little things like not being able to get a haircut were making others panic, I just shrugged. Everything's awful, humans are mortal, it's Tuesday again. First time? In hindsight, I think the pandemic response showed clearly why Donald J. Trump would be reelected. Americans are addicted to an artificial sense of predictable normalcy that simply does not exist, especially in an era of end-stage capitalism, climate catastrophe, and plague. But like any addict, we don't care who gets harmed as long as we get our fix. And what did I get for my work? $19 per hour, called a hero, and easier parking because we had fewer visitors. Oh, and I think they passed out meal vouchers one night during a particularly bad surge. Sorry to be self-centered, but I'm a veteran of a war against a disease. I fought with it twice while caring for others. I wasn't frontline, but I was forward support. And all I have to show for it is lung scarring and a forgettable spot on my resume that says, worked during COVID-19. Even my retirement match got lowered during the economic slump caused by the shutdowns, so as far as my retirement is concerned, I only worked half-time for that period. Story 18. Inextricably changed my life. Lost trust in family and friends. The behavior of some is almost worse than the actual virus. The selfishness, the greed, the unwillingness to fight the virus with science. I called it to my coworkers as we saw the news from China in late December. It happened, and I never wish it did. I'm a different person because of it. Life will never be the same since seeing good people get commandeered by lies and anecdotal stories. Social media is an equal partner in the virus's death toll. Misinformation killed many. Story 19. Lockdowns were a mistake. Not the initial one, but the idea of opening and closing constantly while big businesses got a free pass was blatant hypocrisy. The federal government failed people on so many levels, and we are supposed to just pretend it's all okay now. How many businesses went under? How many people became homeless? How many companies got rich while small shops were hit with fines? Story 20. It made me lose a ton of faith in my fellow human. Took people away from me forever that I loved deeply. The lockdowns were horrid and messed up a whole generation of people, namely kids. Necessary but awful, that bit. It was handled fine at times and terribly at times and proved we were not as ready for such a large disaster as we thought we were. Story 21. Anyone who works in the schools can give you a list of problems that the shutdown created. Huge academic gaps, an increase in behavioral issues, kids with no social development, and no self-regulating skills. To be fair, we've also seen an increase in this with the adult population too. Look at the increase in road rage incidents, airline rage incidents, and other poor behaviors from people who really should know better. My takeaway is that we left families on their own for an extended period of time, and what we really learned is that the level of dysfunction present in many homes is unprecedented. Story 22. It bothers me that we keep talking about COVID-19 in retrospect. It is still a thing that people catch, but more than that, we are still dealing with the economic ramifications of it. Story 23. My experience was pretty good, to be honest. I kept working throughout with less socializing pressure, and no one I know died or was seriously ill. However, as a microbiologist, I was constantly frustrated with the television over many misguided policies that were put in place and a complete disregard for medical and epidemiological data. Story 24. 1. Modern vaccine development is astonishingly good. Came out so quickly compared to the past. I hate how people have turned being against public health into an identity. We could have normalized air filtering, hazard pay for essential workers, staying home when sick, etc. Instead, public health became the stupidest self-sabotaging culture war issue yet, and there have been so many stupid ones. Story 25. My parents were in New Zealand for the lockdown. They went from severe lockdowns, legally not being able to go anywhere for up to a week, to complete freedom because the entire country was COVID-free. I know it's different because it's a nation of islands, but I am so glad that they were there and not in the United States. Being in New Zealand now is like being in a pre-COVID world. People are noticeably nicer, things are relatively normal still, and the United States has changed for the worse. People are happy with being totally insane in their beliefs and what they will fight for. Story 26. Same thought I had in the beginning. We should have been realistic and given high-risk people the option to quarantine themselves instead of shutting the whole world down. Inflation took off out of control due to the lockdowns. People were scared out of their minds. People went broke. It caused a lot of problems and essentially created a post-COVID world that is definitely not better off than what it was before. Story 27. I feel like the United States specifically mishandled the entire situation, and we are worse off today as a result. Vaccines are now questioned by some, which was never the case before. Not just for COVID-19, but also for things like the flu, hepatitis, and polio. These same people continue to spread misinformation on general health guidelines and practices. Now, you have someone from a small town in the United States posting on Instagram who thinks they know more than the person who spent over 8 years in medical school.